Dr. Mona Hanna-Attisha, known as Dr. Mona. She is the daughter of Iraqi immigrants living in Detroit. She's a pediatrician. She has helped expose the Flint Water crisis in 2015. Her memoir, released June 2018, What the Eyes Don't See, A Story of Crisis, Hope, and Resistance in an American City, has landed on the 2018 Oprah Winfrey's list of the top books to read this summer. In 2016, she was named one of Time Magazine's 100 most influential people in the world. Dr. Mona is with me today to discuss how her family's immigrant roots and activist background influenced her career as a doctor and scientist and inspired her in pursuit of justice and exposing the Flint water disaster. It's not even a crisis, I would call it a disaster after you hear what Dr. Mona has to say. So how are you? Welcome, and appreciate you coming on and your time. Thank you very much.
Brad, it's great to be with you. Thank you.
So Dr. Mona, you are the director of the Michigan State University Children's Hospital Pediatric Public Health Initiative. You mitigated the impact of the Flint water crisis. You're a professor of pediatrics at Michigan State University. How did you get involved in this whole Flint water crisis? What happened?
So for about 17 months, Flint had switched their water source to the Flint River without treating it properly. It was missing corrosion control. Lots of complaints about the water, but I assumed everything was okay.
What year was this? What year was this?
2014.
Okay, so
April 2014.
They switched the water supply, and they say everything's good.
Everything's good for 17 months, despite residents' complaints. They knew something was wrong. There was color, odor, taste issues. But, I was going along my busy work as a pediatrician, and I was believing what the government said. I mean, why wouldn't you? America.
Are you a resident of Flint? You have patients from Flint? Are you near Flint? Or all three?
No, yeah, so we're actually in Flint right now. But I work in Flint. I don't live in Flint, but I work in Flint. And the patients I care for live in Flint. And they were coming to me asking me if the water was okay. And how could the water not be okay? It's, who doesn't assume that when you turn on your tap, your water is not okay?
So they were complaining. Who did they complain to? They complained to you as a doctor. They complained to who else? Who would they complain to?
Everybody, every level of government, the city, the state, federal government, including the EPA. Flint had lost democracy. We were under state-appointed emergency management, and the only focus was austerity to save money. So the voices of the citizens of Flint were being dismissed and denied throughout the story.
So who was in charge? Who was ultimately in charge of diverting the water? It went from one river to the other. And whose ultimate decision was that?
Yeah, it went from the Great Lakes, which we had been getting for half a century.
It's a freshwater source?
And the best, highest quality water source. And it was switched to the Flint River without proper treatment. And that decision was made by the emergency managers who report to the governor. So this was a state-driven decision.
Why was the Flint River being polluted by industry, or is it just a contaminated river just by nature?
That's a great question. So the Flint River has a history of legacy pollution. It's actually caught on fire twice. But the river was not the problem. The problem was the water was not treated with corrosion control, an important ingredient. And without that treatment, the water was about 19 times more corrosive. It ate up our pipes. Lead from our pipes went into our drinking water and into the bodies of our children.
And people are complaining this water is not being treated. Flint is no longer being run by the local citizens. It's being run by an outside agency, whether it's the state or whatever agency is responsible for running it. They basically went bankrupt, I guess, the city.
Yep.
And they switched the water source, I guess, to save money. What was the savings that they got from switching the water source? And number two, what could they have spent? Was it a very expensive thing to treat this water?
Yeah, so the savings were estimated in the millions of dollars. I don't remember the exact number, but maybe about $30 million to switch from the Great Lakes to the Flint River. However, it only would have cost $80 to $100 a day to add this proper treatment chemical that was not added. And that was not added, and the pump to install that treatment chemical was never installed. So there was really never even an intention to treat this water properly.
So let me get this straight. $80 a day, we'll do the math in my head, $560 a week, right? For a little over $500 a week, they could have saved lives and saved that and the health risks that they've put the entire city under for $500 a week.
Yep, and the cost of our recovery thus far is close to $1 billion. And that is just the beginning of the investment that is needed to make Flint whole again.
All right, so let's take a step back. You said everybody's complaining. They were complaining that there was a smell to the water, or were they complaining that the water didn't taste well, or were they literally coming to you, both adults and children, saying, I feel sick, I think it's the water?
So really all of the above. There were citywide complaints about odor, quality, taste. Bacteria was in the water. Chlorine was added, which irritated people's skin and eyes. Lots of issues. Parents coming in with vague complaints about children. But for 17 months, everybody was being reassured. Even when General Motors, which was born in Flint, after just a few months of the water switch, noticed that their engine parts were corroding from this water source, and they got a bypass to go back to the Great Lakes, but the people of Flint were literally told to relax.
All right, so General Motors, okay, the water from this water source, Flint River, is corroding metal. But so you can only imagine what it was doing to the human body. Okay?
Absolutely.
And they say, okay, we want General Motors to be okay. We'll save the metal. Who cares about the children and the adults in Flint, Michigan? That's basically what they said.
Clear disregard for public health and children's health.
I assume as a doctor, you believed, certainly in the beginning, that what the public officials are saying, public health officials are saying, both locally and from the EPA and from the state level, that this water source is safe. What were they saying about the water source? Were they saying because they're adding chlorine, it was killing all of the whatever bacteria or viruses were in the water, and they said therefore it's safe? What were they saying to try to convince the public that this was safe water?
Yeah, so after every really concern by residents, by city officials, there was reassurances that the water is testing fine, that it meets compliance guidelines. Lots of different phrases that literally one government spokesperson said that you can relax, that if you're worried about lead, you should just relax. So lots of reassurances about all the multiple complaints that were coming in about this water.
So then what piqued your interest in this? Obviously you're seeing sick children, but when did you start trying to connect the dots, saying, wait a second, something is wrong?
Yeah, so the title of this book is What the Eyes Don't See. And that's because we do not see lead in water. It's colorless, it's odorless. And actually, children were really not presenting with symptoms because our eyes do not see the symptoms of lead poisoning. It's known as a silent pediatric epidemic. But my eyes were opened when a girlfriend of mine, high school girlfriend, who happens to be a drinking water expert, was at my home and shared what she knew, which was that the water was not being treated with corrosion control, and thus we would have lead in the water. And from that moment on, I began this almost quest to uncover what was happening to our children.
So now, before that conversation where your friend just happened to have known, she was a former, EPA official, I guess?
Yeah.
And she just kind of blurted it out in general conversation. You were seeing children presenting with lead. But, right?
So,
I guess you take a blood test and you see the lead level is risen in their blood. That's the only way to determine it. What does lead do to children? What does lead do to adults?
Great question. And that's when my life changed, when I heard the word lead. Because as a pediatrician, we know what lead does. It is a poison. It's an irreversible neurotoxin with no safe level. It impacts children's cognition, dropping IQ levels, impacts their behavior. It alters their entire life course trajectory. We are never supposed to use children. We're never supposed to expose them to lead because really we are only, when we detect it in a child, it just tells us there's an environmental problem.
So, so prior to your conversation with your friend, children were presenting with lead, I assume you did blood tests. What were you telling the parents the cause was? So you had no idea why this was happening?
So Flint is already a city that has higher rates of lead exposure, just like cities like Detroit, Chicago, New York, Baltimore. Inner city children with poor housing stock are already exposed to lead. So we already see kids with lead poisoning. This also talks about the difference between individual medicine and public health. I can take care of one kid at a time, but I can't tell you there's an epidemic. That's where your eyes need to step back and you need to have a bigger view of what's happening at a population level.
Okay, so now you're taking more of a public health look at this once you have this meeting with your friend who says, by the way, they're not treating this water like they're saying it. It was almost like she was almost like the deep throat from the Watergate, exposing this. What did you do at that point? Where did you go about trying to find this proof? Who did you go to? How did you speak up? Because now it's time to stop being a private doctor and being a concerned public advocate. What did you do?
Absolutely. So this is a story about opening your eyes, about recognizing injustices no matter where they are, about being loud and stubborn and persistent, being an activist and being a resistor. And that's a lesson we all need right now. So when I heard this, I knew I needed proof. I needed the data, that big data, the population level data. And I wasn't getting that. Nobody was giving it to me at the county and state level. So I decided to do my own research with our hospital records to see what was happening to the lead levels of our children.
Well, okay, so you started doing a statistical analysis of the lead levels of the children. Is there a way that you as a private citizen could go to the Home Depot or Amazon.com and buy a lead testing kit and just put it under your tap water and see if there's lead coming out of the water? Is that possible?
There are some of those kits at like Home Depot or Lowe's.
Right.
You can buy those things, but it's very variable. And the water testing we knew. So Mark Edwards, a scientist from Virginia, had come and done water testing of all of Flint, working hand in hand with the people of Flint, and had scientifically proven there was lead in the water. But he was also being dismissed and denied and attacked.
So he was being discredited by who?
By the state.
And what did the state say? What was the state saying? He's a quack. He doesn't know how to do research. He's
pretty much
basically right. He's left of center. He's not in the mainstream of scientific analysis.
Yeah,
and all of that.
They essentially called him a magician, and that he would pull rabbits out of hats. Wherever he went, he would pull lead out of water. And this is a MacArthur genius. Like, this guy is a genius, one of the world's experts in lead and water. And he was also being attacked.
So here's a situation where the politicians are lying to people on a regular basis, telling them they're safe, almost brainwashing them to believing that everything is okay when it's not. So this man is discredited by the state. They basically come out with a publicity, tweets, evidence, social media, news conferences, whatever they do, they convince the public it's safe to drink the water. Now you're seeing higher levels of lead in children. This man who is a very well-respected scientist is being discredited. It is apparent by everybody's scientific knowledge there's lead and it's poisoning children. So what do? You go about, how did you do this statistical analysis and turn this statistical analysis into confirming what this scientist is saying about the lead in the water?
Yeah, so the book really goes through that fast-paced research of what we discovered. And what we discovered was an increase in the percentage of children's lead levels after the water switch. And I walked out of my clinic and I stepped into a press conference and shared that research. And that is not something that doctors do. But at this point, we had no other choice. I had no other choice. As a physician, I literally took an oath to protect children. I stood up and said I would be the voice of children and be their protector and healer. And we did. And just like everybody else in the story, we were also attacked. My science was attacked. My credibility was attacked. And the facts and the science were dismissed.
Well, how did you go about proving? Because I could assume how they would attack you. I haven't read the book yet, but I'm actually very excited to read it. But I would assume how they would attack you would be something to the effect of it's more of a coincidence. What there's a lot of contributing factors that can go into increased lead in children, and switching the water sources is you haven't proven that is the reason for the increase in lead. It's just a coincidence that it happened at that time. Is that basically what they were saying?
They said I was splicing and dicing numbers, that I was an unfortunate researcher, that I was causing hysteria, and that their numbers, the state's big data, was not consistent with my data. So they had a lot of rebuttals to our facts. But ultimately, we countered all of that because we had controls for all these confounding factors. And despite all those controls, there still was an increase, and there was no increase outside of Flint. The increase was only in Flint, and in areas where the water lead levels were the highest, we also saw the greatest increase in children's lead levels. So lots of statistics really supported what we knew.
When they were rebutting you and basically saying you're slicing, you're dicing, you're a quack, your research is terrible, did you ever doubt your research? Did you ever say, hey, you know what? They're so good at this publicity machine about convincing people. Did they ever try to convince you, or did you ever have doubt that said, you know what I'm seeing with my eyes and my own research, maybe I'm wrong?
And the book goes through those incredible, powerful emotions, because for a moment I felt I was wrong, and I was scared, and I was sick, and there was a knot in my stomach that would not go away. When the entire state tells you you're wrong, it's hard not to believe them. But that lasted a few moments, and ultimately the kids put me back in this fight, because I was fighting for their future, for the lives that were growing inside them and their entire potential. And they got me back, and they got me back with punching bags on.
So basically, after, if I understand this, after you had a little doubt now because they're really coming and attacking you, but you're still in your private practice and you're seeing kids every day sick, and you're saying, you know what, it can't be anything else. Every day you're seeing sick kids with lead poisoning. How did you eventually convince the authorities that you were correct, or did you first convince the public you were correct and then the authorities had to come around? Which way was it?
Yeah, so when we had our press conference that shared this data, the public finally breathed a sigh of relief, because they knew something was wrong, but they didn't know what. So it was a validation of their concerns. So they were obviously on board and had been on board. And then after a few weeks, finally the state went back, looked at their data, and conceded. They conceded and said, our data are consistent with your data. There is a lead problem. So ultimately, it was our science that spoke truth to power.
How long was it from the time that you exposed this in your press conference to the time that the state and the EPA said, you're right, Dr. Mona?
It was a matter of a couple weeks.
And then at that point, what did you do? What did the state do to try to rectify this?
So within a few weeks after that, we went back to Great Lakes Water. And from that very moment of recognizing that we had this population-wide exposure, my focus went to the hope. So the story is very much that crisis. It is a story of activism and resistance, but it is so much a story of hope, because what was happening in the water was threatening the tomorrows of all of our children. And from that moment on, my focus went to be to the preserving the tomorrows of those kids.
Now, they're still having problems today, because from what I understand from reading the pre-notes, those pipes that the bad water from Flint River was going through are still contaminated. So even though you have fresh water coming from the Great Lakes, in 2018, 4.5 years after you, or 4 years after you exposed this, nobody can drink the water in Flint still.
You're right. So the 18 months that we were on corrosive, untreated water ate up our pipes. So we are replacing those lead pipes. When we complete that, and by 2020, we'll only be the third city in the country that's done that. But that takes time. And while that's happening, people need to continue taking precautions.
So how many children got sick from all of this?
This is a population-wide exposure. Everybody is considered exposed. And once again, our eyes do not see the symptoms. And it's subclinical. That is why we treat everyone as exposed, and thus everybody is benefiting from the interventions that we are putting in place to mitigate the impact.
Do you get exposed just from drinking it? What about if you shower with it? What if you cook vegetables in it?
Yeah, so drinking and eating, even with food cooked with this, exposes you. There was other things in this water that irritated people's skin and eyes, the bacteria, the chlorine, other things in this water. Lead usually does not cross your skin when showering.
Did you get exposed? You're working in Flint. Maybe.
Yeah, probably. I spend most of my time here, but my brain is pretty much developed. We worry about the youngest children, especially those who were prenatally exposed and the babies.
So you can shower with the water in Flint. You just can't drink or eat or cook with it at this point.
Yes, without a filter.
And you're treating children with lead poisoning to this day.
We are treating everyone as if they were exposed, and thus giving them interventions like literacy programs, childcare, healthcare access, mental health support, home visiting, all of these things that science has proven to benefit children's development.
And so basically what the lead poisoning has done to these children potentially, because you don't know until they grow up, is reduce their brain power, I guess, is in layman's terms. You know, they weren't able to fully develop into who they should have been. Is that correct?
So we hope never to see those consequences. And that is why we have built this model public health program, which I direct, that has put into the place the interventions not to see those consequences. Flint is a place that does not want to be remembered for this crisis, but rather for our innovative recovery. And we do have a system in place to see what is going to happen to Flint. It's a Flint registry modeled after the World Trade Center registry to follow folks over time. And not only to see how Flint is doing, but to share our incredible lessons with kids everywhere who are suffering from the same toxicities, the toxicities of poverty and violence and lost democracy and racism. So we hope to share what we are doing with kids in other places.
Now, besides lead, was there any other poisoning from this water source? Did adults get sick? Did anybody die from this? Was anybody hospitalized from this? What kind of statistics can you show that somebody really suffered, even to this day? We don't know about the future of these children, but suffered right now in the last couple of years.
Yeah, lead is only a small part of the story. The whole crisis is a trauma of betrayal and stress and fear and guilt and anxiety. And that in and of itself can have poor outcomes. We also had one of the largest outbreaks of Legionnaire's disease. Adults, especially elderly, contracted pneumonia and died. At least 12 confirmed deaths from Legionnaire's disease and an overall uptick in pneumonia mortality. Because of that, state officials are actually charged with negligent homicide because of those deaths.
So there are public officials who are now facing criminal charges as a result of you exposing. They killed people and told people it was safe to drink this water, and it wasn't. And I don't even know if it was negligent. It could have even been manslaughter. I don't know, but you know that's for another day. But I'm glad.
And it's ongoing.
It's ongoing. These criminal charges are going on now.
Yeah, absolutely.
So did you testify before Congress about this? Did Congress get involved in this?
Absolutely. They had several hearings. I was called to testify twice at the U.S. Congress as well as at the state level.
And you told them basically the same findings that you told us just now.
Absolutely. As a pediatrician, this is the science, this is what happens to children, and this is what we need to do as a nation to invest in these children to make sure that they recover.
Did Congress do anything, or was it all talk?
After a year and a half of advocacy, Congress finally passed a Flint bill in December of 2016 to help with our pipe replacement and to fund our registry. But that is just a down payment. We need long-term resources.
So who's supplying the water now to Flint? You still can't drink it out of the pipes.
No, the state ended bottled water supply, but there is a supply of filters for the next 2 years.
And is there anywhere that anyone, so why would the state end it? They caused this problem. Did they come up with a reason why they would end it? Don't they have an obligation to provide safe water?
Great points. They said that our water is testing better and that they no longer have to supply it. But it should have continued. Our water is testing better, but because of the infrastructure work, there's still risks.
So, so where can people find out more about all of this? But they can read your book. It's on. It's
yeah.
You can go. Tell us about your book a little bit and where you can find it, and then I want to find out a little bit about your background and your history.
Sure. So the book is available everywhere. Like you mentioned, it's on Oprah's summer reading list. New York Times has a cover review on it this weekend in book review. It's been mentioned. New York Times mentioned it's the first book to read when you want to learn more about this issue. But this book, like I mentioned earlier, is so much more than just about Flint. You know, it is ultimately about people, places, and problems all over that we choose not to see. And it is about our obligation as human beings, our civic responsibility to open our eyes and to care for these populations and to be aware of these injustices. So I very much, it is a timely book. It's a book about, like I said, activism, about resistance, about fighting for injustices, and creating hope in communities, especially for children. It is also, like you alluded to, it's an immigrant story. And I don't think that part of this book would have been as big if it wasn't for the last election. I'm a first-generation immigrant. We came to this country when I was 4, very much for freedom, for opportunity, for democracy, for that American dream. And that was realized for me and my family. Lady Liberty opened her arms for me and my family, and that is not happening today.